Okay, Tasha, do you want to kick us off?
Sure. Thanks, April. Good morning, everyone. My name is Tasha Gill. I am the Associate Director of Diversity and Workforce Initiatives at Lurie Children's Hospital. I'd like to welcome you to the Chicagoland Healthcare Workforce Collaborative quarterly meeting. As April has mentioned, please introduce yourselves in the chat with your name, title, and organization. We would love to know who's attending today. Before we get started, please mute the microphones on your devices. This meeting is being recorded and we want to limit background noise as much as possible. Today's recording and slides will be provided by Thursday at the latest. And so on this slide on the left, you can see the mission of the Chicagoland Healthcare Workforce Collaborative. And on the right, we have our 3 strategic pillars that focus on hiring, training, and career pathways. We are an employer-led partnership that includes our hospital systems across the Chicagoland area who provide care and employment opportunities. For our agenda on the next slide, April will discuss our 2024 survey results and our strategic goals for 2025, followed by Lightcast healthcare workforce data. We have an opportunity for discussion in breakout rooms, which I'm sure will be pretty exciting. When we return from our breakout discussions, we will receive project updates on our Good Jobs Challenge CNA programs and the Equitable Career Pathways program. We will round out our meeting with policy updates from Jordan Powell and close with community announcements. And on the next slide, April will begin our discussion of our strategic plan. And so I'd like to turn the meeting over to April Harrington.
Thank you so much, Tasha. Welcome everyone to our first quarterly meeting of 2025. I'm April Harrington, the project manager of the Chicagoland Healthcare Workforce Collaborative. We do have a packed agenda today, and we're going to be moving pretty quickly. I have included some links to the full materials on our website, and I just dropped that in the chat. So you can take a look at more of the details of our 2024 survey results, our 2025 strategic plan, or both of the Lightcast workforce data reports that we're going to look a little bit at today. Those are all posted on the quarterly agenda on our website. And the recording and the full slide deck will be available there tomorrow. So first, let's talk about what we are doing this year. Last year, actually 2 years ago, at the end of 2023, we had a steering committee retreat to talk about who CHWC is and who we want to be in the coming years. And we came up with a 5-year vision that's displayed on the screen. Is that CHWC is a healthcare workforce development think tank led by exceptional healthcare workforce leaders with experience in health equity, workforce development, community engagement, and diversity, equity, and inclusion. And that CHWC is recognized locally and nationally as an exemplary model of peer learning and collective problem solving. So we are really leaning into our purpose as a peer learning space and as a space where you all can share what's working, what's not, look at data together, and brainstorm solutions to our shared workforce issues. Here is a little snippet of the survey results from the end of last year. Thank you all to those who filled out this survey. This slide shows us that we're pretty much on the right track with providing this peer learning space. On all of these 4 graphs, the blue portion is the top score, meaning strongly agree or essential, and then the red is the second one under, meaning somewhat agree or important. So you can see here that when asked how important is your engagement with CHWC to meeting your organizational goals, we have 45.8% saying it's essential to 50% saying it's important. No one saying that it's not important. And then we increase our scores a bit when asking, how much do you agree with the statement that I am able to make meaningful connections with my peers and other healthcare stakeholders through CHWC? I view my involvement with CHWC as a means of making significant positive impact, and that I have taken things I have learned at CHWC back to my organization. So to me, this says we're on the right track. We are providing a meaningful peer learning space that's of value to all of you in your jobs. So that's great to hear, and we're going to do more of that this year. Here are some selected responses to a few questions that have really helped to inform our goals for this year. On the top left there, you'll see it asks what topics partners would like to learn from at learning events this year. The number one topic with the most votes was apprenticeships. So we will be hosting an event solely on apprenticeships this year. Number two is career pathway building. I have another event to announce this month that has to do with career pathway building. In third place, we had a tie between career exposure and navigation and workforce programming funding. And then in fourth place, a three-way tie between frontline employee retention, workforce data, and workforce programming return on investment. And I hope you'll see that we've already incorporated many of those topics into existing learning events this year, as well as planned ones in the future. On the top right, we asked the question, what is one additional thing CHWC could do or do better to help you reach your organizational goals? And I just picked out a couple of things that resonated with me in the steering committee here. One idea was a shared contact list, and that's something I am discussing with the steering committee to see if we might pull together this year. Continue to identify funding opportunities, which I always am trying to figure out how to help you better with. Finding alignment across target roles to focus on and address pipeline attraction. We are doing that this year with respiratory therapy, more than that in just a moment. Add another in-person event. We're going to do that with our apprentice event, and help my institution find opportunities to launch nursing programs, which we do have some programming around and I hope to do. And finally, I want to just pull out a couple of comments at this question at the bottom. Is there anything else you would like the CHWC team to consider as they develop plans for next year? We had a couple of comments around celebrating participant success and involving those who have benefited from the programs and hearing their voices at meetings. I love this feedback. I think it's really important to keep participant voice front and center. Sasha will be giving an update from the Good Jobs Challenge later in the meeting and share how we are working to incorporate more participant voice, participant stories, and we're going to bring that into our September meeting, which will focus solely on the Good Jobs Challenge. And I want to make sure that we are elevating those voices and bringing them to you at that meeting. All of these survey results are compiled in that link that I put in the chat. I'm going to move on to our 2025 strategic plan priorities, but if you have any questions, feel free to put them in the chat, or I'll pause for questions after sharing some of our 2025 goals. So our 2025 goals were largely put together by our steering committee at our end of year retreat, as well as informed by your survey results and the experience of how well our meetings and events are attended and the feedback we receive. So we are primarily a peer learning space. We are going to continue to lean into that. On the left side, you'll see our goals around fostering peer learning and connections amongst you. We will host at least 6 learning events this year, and we are off to a running head start. We have already hosted 3 virtual learning events. All of those are available on the website with the recording and the slides. And I have another event that I'm announcing for the end of March. So I think we will easily hit that goal to host at least 6 events. Based on your number one topic of interest, apprenticeships, we are going to host an in-person event on apprenticeships later this year. I do not have a date for that yet, but pay attention to our newsletters and at the website, and we'll announce that shortly. We're also hosting a respiratory therapy workforce summit in the fall. Dates are also TBD for that. This is an idea that came out of the steering committee as we discussed, that there's only so much we can do as a table in talking about healthcare workforce shortages generally. A lot of us here have some knowledge of the shortage of nurses or medical assistants or surgical techs, for example, but we don't often have a lot of involvement from the people who hire and run those clinical programs within hospitals or build those departments at our community colleges, and train those specific occupations. So we thought it would be a good idea to start hosting some more occupation-specific events and do some of the legwork to get the right people at the table. And we are starting with respiratory therapy. We have a shortage of respiratory therapists in our region. I have done a lot of fact-finding and meeting of the subject matter experts in our region around the workforce, the respiratory therapy workforce shortage. And so we're going to plan an event around that in the fall. If you want to get involved with that or have questions for me, just put that in the chat or feel free to reach out to me via email. That date will be announced within the next couple of months. And then finally, we are going to host another in-person employer peer learning session like we did last year. That will likely be in the spring, and that date will likely be announced shortly. Another goal that we wanted to add to our strategic plan this year is to bring data into our conversations more frequently, more often. I am very happy that we are able to partner with the Chicago Cook Workforce Partnership to access data reports from Lightcast. And we're going to look at some of those today, so I'll tell you a little bit more about it. But I am committing to bringing 2 of our general reports on Cook County hospitals and health systems on a quarterly basis. So while we won't do a deep dive into the data at all of our quarterly meetings, on a quarterly basis, you will be able to find those general Lightcast reports and track any changes that the Lightcast data is showing. I will also be bringing more occupation and program specific Lightcast data into learning events as appropriate. And then we will also continue to try and increase the CHWC visibility and build our reputation, leverage our collective voice, and perhaps there might be some policy opportunities to do that this year. I'm happy that we'll be hearing from Jordan Powell from the Illinois Health and Hospital Association about some policy priorities later in this meeting. And then, of course, I want to continue to support efforts to fund workforce projects. This lists our programs that we're currently overseeing at CHWC. The Good Jobs Challenge, you will have an update from Sasha on that later in this meeting. The Career Pathways resource is a tool that I'm working with other partners to build. This is a tool that will help students and job seekers and employees navigate the myriad career opportunities in health. And you will hear more about the Career Pathways resource project at our June quarterly meeting. So I won't get into that too deeply right now. Then there's the Advancing Equitable Career Pathways grant. You will be hearing more about that today. That is our grant that is focused on increasing Black male participation and success at Malcolm X College and their healthcare tracks. And finally, we are also a partner on a Chicago Community Trust grant to the City Colleges of Chicago to support planning of a PCT to Associate's Degree RN pathway that I am also hoping we'll have more updates on in the coming quarterly meetings. And then I've also listed the Youth Pathways Committee on this slide and some of their goals. Many of you on this call have been a part of that committee. If you are someone who focuses on building youth programs and exposing youth to careers in health, I highly encourage you to join this committee if you are not a member already. Matt McClintock leads that committee at Health and Medicine Policy Research Group. I'm going to put his contact info in the chat. And this is also a shared committee with the Public Health Workforce Collaborative. If you don't know about the Public Health Workforce Collaborative and would like to join their meetings, feel free to say so in the chat. Anna Yankelev is here. She leads that group. You can also feel free to message her. So we are moving quickly today. Does anyone have questions about our strategic plan? I'll leave that up for a second. Anyone have questions or reflections on the survey results or strategic plan for this year? And you can read more about them in those links on our website that I put in the chat. Awesome. Okay. I wanted to tell you about our next learning event. I'm really excited about this because I've been trying to put this event together for a while. This is part of our Career Pathway Programs Across the Nation series. I believe it's our fourth or fifth event in this series where I am bringing in other health employers from across the nation and their partners to share a little bit about what they're doing in a different region. This one is completely focused on helping nurses or helping people move up through the nursing pathway. So our first presenter at this event is University of Vermont Medical Center. They have a licensed nursing assistant to associate's degree registered nurse pathway program that supports people in finishing their prerequisites, then supports people in earning their LPN, and then through their associate's degree RN. There are wraparound supports and paid study time each week. And then there's an interesting model whereby, as they graduate and work as registered nurses, the University of Vermont then continually pays off their student loans. Then our second presenter will be someone from Atrium, which is now a part of Advocate, but Atrium is centered in Charlotte, North Carolina, and is their RN Educational Assistance Program. It targets employees who are already accepted into associate's degree or bachelor's degree of nursing programs and provides them with paid tuition, as well as paid education time, support for their books and fees. And you can see that they have some impressive numbers. Since the program started in 2018, they have enrolled 157 participants. 38 of those have already graduated since it started in 2018. And the retention rate amongst current participants is 93%. So I am going to put a link in the chat to register for that learning event on March 27th, 11 a.m. to 12. And now let's talk workforce data. So as I mentioned, we are lucky to be able to access some Lightcast data through our relationship with the Chicago Clerk Workforce Partnership. For those that are unfamiliar with Lightcast, Lightcast is a company that collects labor market data points from a variety of sources and compiles them to provide industry insights across the country, perhaps across the globe, I'm not even sure, in different sectors. They have created their own taxonomies to organize occupations, titles, and skills. And as I have been reading through some of the reports, I've sometimes found them a little confusing. What is the difference between an occupation and a title? If you go and access those reports, please know that Lightcast has a lot of really useful articles on their website that you can access without a subscription on their taxonomies and on their methodology and where the data is coming from to help you navigate. But all the data is coming from US Census Bureau, Labor of Statistics, as well as the scraping of 65,000 job posting sites worldwide. So I'm going to share a little bit of the data, and I'm letting you know that we're going to go into small breakout rooms, and in those breakout rooms, you're going to discuss what you found most interesting, most compelling, what surprised you. And you won't have access to the slides, so if you want to jot some things down as I'm walking through these, feel free. So who is working in Cook County's general medical and surgical hospitals? And those are the reports that we've downloaded. Perhaps unsurprisingly, they're 76% female. When we look at the age breakdown, our largest group at around 28% is from 25 to 34 years old. but we have around 6.5% that are over 65 and 16.6% that are in that 55 to 64 age range. When we look at our race and ethnicity breakdown, almost half of our workforce is white, about 20% identifies as Black or African American, and about 17% is Hispanic and Latino, 14% Asian. Who are we hiring? What you see on the left here are the top posted occupations. This is based on Lightcast's methodology for grouping occupations. So the top occupation that they are seeing posted across all of the job posting sites in Cook County is registered nurses. Second most is a other category of health technologists and technicians. So I'm not actually completely sure who is in there. Third is medical assistants, medical and health services managers, nursing assistants, respiratory therapists, other technologists. Down at the bottom here of this top list, we have phlebotomists, pharmacy techs, and surgical techs. When you look over the job titles here, these are the actual titles that are listed on the job postings. And the top job title is patient care technician, which I think is interesting because the occupation patient care technician is not listed, but nursing assistants are up top. That's something we've been talking about a lot in the Good Jobs Challenge community of practice, and we'll talk about more in coming meetings. Phlebotomists is our second job title, and then respiratory therapists and nurses. Who's hiring and how many openings are posted? Right now, there are about 22,000 unique postings in Cook County for general surgical medical hospitals. So that doesn't include all of healthcare employers. Top companies, this is you all here: Northwestern, Rush, Trinity, Sinai, Edward Elmhurst, University of Chicago. I'm actually surprised Advocate isn't there because Advocate has been on similar lists. In the unique postings trend, you'll see that this goes back to February of 2020. And then this would be February of 2025. To me, it looks like there's a little bit of an increase in how many people we were hiring in the job postings up through February of 2023. And now we're seeing a little bit of a decline. This is an interesting data set that Lightcast shares, which is based on skills. So there are two skills slides here: specialized skills and common skills. And what Lightcast does is look at the frequency that we are requesting these skills in job postings compared to the frequency of these skills showing up in job seekers' profiles. So this shows that nursing is the top specialized skill that we are asking for, and we are not the supply of applicants who have the nursing specialized skill is much lower than the frequency in which we're posting for them. Medical records is second, CPR, direct patient care, patient safety, electronic medical records, quality improvement, radiology, effective communication, and process improvement are down here, which those actually show up on the next slide, which is what common skills are in demand. Communication is the most common, what Lightcast is referring to as common skills requirement that's showing up in profiles. And then leadership, lifting ability, which I guess it's not surprising that applicants are not listing their lifting ability in their profiles. Management, ethical standards, customer service, computer literacy. And this is interesting that computer literacy we're not seeing that in profiles as much as it's being asked for: coordinating interpersonal communications and problem solving. Okay, I have one more piece of data to share with you. All of that was taken from the two reports that were pulled just a couple of weeks ago, or less than 2 weeks ago, in the end of February. this, this slide, this data is pulled from several occupation reports that I pulled back in November. So this is the kind of interesting insights that we can get from some of those more granular reports in Lightcast. I pulled 4 reports for nursing assistants, licensed practical nurses, registered nurses, and nurse practitioners. And so this sort of goes up the ladder in terms of how long it takes to earn these credentials and what these the earning potential of these certifications or licenses. Nursing assistants in Cook County are making an average of around $20, while LPNs are earning an average around 31, 32, registered nurses 40, and then nurse practitioners 60. But then you can see here that the largest group in nursing assistants, when we look at race, is about 50% Black or African American, 23, 24% white, and then 15% Hispanic and Latino. That's that bar there. When we go up to the next level here, we're still have the largest group is Black or African American at 41.5%. When we move up the next rung in the ladder to registered nursing, our majority piece of the pie here at almost 54% is white, whereas our share of Black and African American registered nurses drops down to a little less than 18%. And Hispanic and Latino drops down to 10%. Nurse practitioners, the share of the pie that is white grows to almost 66%. Those that are Black or African American drop down to 11.7%. So we are going to, first, does anyone have, I might not be able to answer all your questions, and the Lightcast reports are shared with you, but does anyone have a question or an observation that they want to share right now? Okay, we're going to do breakout rooms, and then I will invite you back to share a little bit. Oh, go for it, Tara.
No, I was just gonna say it's not surprising, as you know, with the work that we do at but yeah, I just want to say occupational segregation is still real in this sector. And so looking forward to, talking about that data and looking for ways to decrease that.
April, I do have another question. I was wondering, do we have any data also based on gender, like the difference between, these people in these roles based on their gender, or is it just on race? Salary wise.
So the 4 graphs that I presented on CNAs, LPNs, registered nurses, and nurse practitioners, yes, I had full reports on each of those occupations. So we can look at CNAs, for example, and see what the gender breakdown is, and also the age breakdown. So there's a lot that we can pull on Lightcast. So I'm gonna put you into breakout rooms where they're going to be small, about 2 to 3 people per breakout room, where you can really connect with 1 or 2 people. We're going to do that for 10 minutes. So I'll bring you back at 9:10 to share some more of your observations with the full group. And I also have a question to ask you in AHA slides. So I am launching. I'm opening breakout rooms right now. If you're not able to join, that's okay. You can just hang out with me. And you're going to introduce yourself and just talk about what resonated with you. What did you find interesting, surprising, thought-provoking? I will put that question in the chat, and we will come back in 10 minutes to share.
Hey, April, it's Anna.
Hey,
Hey, I'm in the car right now, so I'm gonna hang out with you here because I couldn't see any of the reports. But I wanted to ask who from the partnership was actually able to get that Lightcast data for you.
yes, I'm just moving people who are alone. I think I got everybody. Her name is Carly. And I would be happy to email introduce you. She was very helpful and very quick.
Yeah, if you could introduce me and Mia, that would be lovely. Thank you. I'm glad they were finally able to figure out who had the license. Also, I wanted to offer that the next CHWC meeting on the 12th or 13th, I can't remember when next Thursday is apprenticeship themed. So focusing on, like apprenticeships for CHWs primarily, but Jake is going to come and do like an apprenticeship 101. So if you wanted to offer to your members if they are eager for more info on apprenticeships, they are more than welcome to join us next PHWC meeting.
Cool. And you're in the car.
I am in the car.
Let me just. But if they want to join, email you.
Yes.
Okay. What day is it at?
It is next Thursday. I can't remember if that is the 12th or the 13th off the top of my head, from 1 to 2:30.
Having like a hard time. Accessing everything on my computer right now.
Allegedly, there's a new computer waiting for me at the office, and I cannot wait because my machine is just clunking along barely.
Okay, I will definitely make an announcement about the Public Health Workforce Collaborative meeting. I'm using a second screen, which I'm excited about, and I should have done ages ago, but I'm finding it difficult to figure out where everything is.
Hey,
Yeah.
April. This is Lisa Harris. I'm also in the car, but I did have a quick question if now's a good time.
Yeah.
The data you're sharing for the Cook and Chicagoland area, is that also available statewide? Do you have access to that?
I believe so. Yeah.
Some of those figures on the skills versus what positions are open and the misalignment there, I think would be super interesting for some of the initiatives we're working on. So I'll coordinate with you afterwards, but I was just curious if that data source covered Illinois as a whole.
I am sure that Lightcast is definitely capable of running an Illinois-wide report. I just don't know if my source for those reports can give that to you, but I'm more than willing to ask.
Okay, yeah, I'll coordinate offline. Don't worry about it
Yeah.
now, but very interesting. Thank you.
Of course.
It's called Lightcast.
Lightcast. Mm-hmm. Hi, Nora, I believe you just joined. We're in breakout rooms discussing some data we just looked at, but everyone will be coming back in about 4 minutes.
Okay, amazing. Sounds good. So sorry I'm late. Our childcare was a little late, but happy to be here.
No worries at all.
Hey, April. Just want to say hi.
Hi, Brian. How are you
Hey,
doing?
I'm good. I'm hanging out with you because I'm having construction done at home, so it's a little rambunctious over here right now.
Oh, got it. I
Yeah.
hope it's going well.
Oh, it is. A man cave is in the works.
Ooh. We're closing breakout rooms in 3 minutes. Welcome back. Hey, welcome back, everybody. I hope you were able to make some good connections and have some good conversations. Can I invite 1 or 2 people to share a little bit about their discussion?
I'll go first, April. Annette. I was in the group with Tasha and Shawanda. I think that was Shawanda, her name. I think this one from Loyola. I dominated the group, not intentionally though, asking questions about the support that was being offered to individuals and what their organization was doing to support furthering them in these challenging times that we're dealing with. And towards the end, one of my partners brought up the fact that the big gap between the CNAs and the actual nurses and nurse practitioners, how come those individuals are not moving up the ladder? And I voiced my opinion again. And I said, well, I bet it's because of childcare and other family circumstances that's surrounding them, that they don't have the support to continue their education and to move up, and other circumstances that are being challenged. And most people don't think about that, because you think if a person is working, well, they can do it, but you can't if you have childcare and you have other family commitments and circumstances, and you don't have the support to move up that ladder, to make that income, to get the certification and grow. And with that being said, I pass the torch back, because I don't know if I represented us well or not. Tasha, you can say if I did.
No, that's something we talk a lot about at CHWC. And I know I've had that conversation with Shonda as well. I hope everyone, if you can, join that learning event where we can learn what is happening in Vermont and North Carolina, because they are finding some ways to help people move up that ladder. Okay, one more person share what they talked about.
Hi, yes. Good morning, everyone. This is Michelle McFarland. And so I was in the breakout room with Sasha and Lauren, and similarly to Annette, that's what we spoke about too. You know, I brought up that the disparity in moving from, I'll even say the LPN level to the RN and nurse practitioner definitely doesn't seem like a big impact of that is academic, because if LPNs are, you know, passing the NCLEX for, you know, the LPN certification license, they surely can for the RN nurse practitioner. I think it's more, as Annette said, and just based off experience, it's that social part of it. It definitely is the child care. And if you're earning, you know, $30 or so as an LPN, that is a life-changing, you know, for some income level. And then to have to mitigate that as you go on to then studying for RN, maybe, you know, working only part-time. And so that housing, child care, and, you know, travel expense, all of that becomes a big part of your decision making on whether you can go on to, you know, earn another or higher license and upskill. So I think that's a lot of the drop off that we see, speaking of, you know, in the African American community.
Yeah, thank you for that, Michelle. Phoenix, and then I'm going to move on and ask you all to give me some more feedback.
We actually spoke a little bit more in our group about, you know, we talk a lot about the education piece and not being able to get to the education, but are there individuals who made it through certification and are having trouble translating that to a job, or not going out for a higher paying job because they don't feel like they qualify? And so we were considering, are there things that we could do in terms of making it more effective? You know, there are terms that brought up, you know, effective communication. I think almost everyone can probably put that in their resume, but we're not. So why not? Could we do that to increase their chances of having their resumes come to the top of the pile? And then also, could we collaborate with our educational partners in terms of looking at a job description for the next role they're going into, maybe midway through their education, and saying, you know, like, let's break this down. What do all these words mean? What does this actually look like? How much have you already accomplished that you could write about or talk to? And what do you still need to do while you're in the education? And that way they have a better chance at a good interview, of being able to craft their resume, things of that nature. You know, are there small actionable things we can do right now to help those who are kind of on their way bump up a little bit or get a higher paying job than, you know, a different role because of the title?
Yes, I love that. There are so many questions there about what is keeping people from that next income level. I'm interested in hearing from all of you about what additional data would help you do your work better. What additional data would be good to bring into a space like CHWC, and to share on a regular basis, or every once in a while. I've put a link in the chat so you can join the AHA slide on your desktop. You can also scan this QR code and just respond as many times as you'd like. What additional data would help you? What additional data will help us in our efforts to create a stronger, more inclusive healthcare workforce? It can be a very specific question. It could be something that Lightcast provides, or something that CHWC would have to request and compile from our partners, or question we don't know where the data might come from. I'll give you a couple minutes to respond to that. If anyone's having trouble accessing it, let me know. So I think as Phoenix was just talking about qualitative data on barriers to advancement, year over year trends, that's something we can, I'm pretty sure we can see in Lightcast, and I can bring that. The data is there. We need to use this data to act. So true. And those that do advance, how quickly does that happen? That's a really interesting question. I've always been interested in the significance of CPS data dashboards and how they can be coalesced with health pathways work. CPS, is that Chicago Public Schools? No.
Yeah, that was my submission,
Oh,
and that
great.
is the Chicago Public Schools. And I don't know, it's I occasionally visit their data dashboards and just, you know, start thinking about these things.
No, yeah, good question. I don't even know that I've seen their data dashboards. I'd be interested in looking at that. The gender and zip code breakdown for employment and nursing assistant, LPN, RN, APRN categories. And that is something I might be able to provide to everyone. Age of participants. Is this a second career for them? That's a really interesting question. Tracking of males entering in the field with age and race. Barriers to advancement. Compensation surveys by tenure. If possible, people retiring and leaving the metro area. Support for advancement. Well, a lot of these are not reflected in the two Lightcast reports that I pulled for today and that you have access to on our website. Some of these do have some insights in those Lightcast reports, so I encourage you to take a look. Having a DEI committee that assesses hiring processes across departments within the organization to look at who is applying versus who is hired while considering the person's skill set, experience, etc. How can we use this data to promote career pathways for new individuals who are curious about the medical field? Very good question. And then a high N survey of the barriers for NALPNs to move into, assuming there are barriers. I'm not sure what an A high N survey is, if anyone wants.
And meaning the number of respondents. So
Oh.
a very large survey as opposed to the
I
few
see.
participants we use currently.
Yeah, good point. It's hard. It's hard to collect data, and it becomes challenging when we're trying to glean insights from a small data set. Tracking reasons why healthcare workers are leaving the industry. These are fantastic. Okay, gonna give one more minute. I'm going to take these into consideration and try and be more of a source for ongoing data for all of our partners at CHWC, perhaps work with our steering committee to design more data surveys of our partners to uncover some insights that we are not going to be able to learn from Lightcast. What motivates people to enter the RN, APRN role, implement growth pathways for current employees. Ooh. Oh, no, that's just me. Can anyone see my screen? No. Yeah.
No.
Okay. Now, can you? Great.
Yes.
Whew. Um, all right, this is great feedback, everybody. Thank you so much. I am going to move on to pass it over to Sasha Ongtenko to give a little update on our Good Jobs Challenge, which has to do with people moving along the nursing pathway and how we might support that better. But thank you all for your feedback on this data. I hope to be able to answer more of your data questions in the future.
Awesome. Thank you, April, and thank you, everyone. That was really actually thought-provoking to see the types of contributions into the AHA slides just now. I think it for me lifts up a lot about there's a lot of data that you all, depending on where you sit within the workforce ecosystem, you have eyes on and are looking for maybe other purposes that have such great application into the problems we're looking to solve with advancement. So maybe there's a world, April, where we like collect the sources, like just links to places too, to gather that data. Thank you all. So just really quickly, Good Jobs Challenge. I am the Pathway Programs Coordinator, serving to support the stewarding of Good Jobs Challenge funds from the Economic Development Administration. And so CHWC is managing a CNA training hub, bringing together five hospital systems with CNA training programs. And our goal is to collectively train approximately 300 CNAs by September 30th of this year, which is when the funding expires. And so the goal, again, is as we've heard, is career advancement, recognizing that job quality and representation, diversity, variety of individuals in those frontline roles, specifically the CNA role, needs a lot more support in terms of being able, we can't change very much rapidly in terms of improving job quality. Could we really look at the CNA role as that stepping stone, as it's often marketed out to individuals looking to start healthcare careers? How can we expose them earlier? Is it possible through our programs that we could provide options and some visibility to what is next beyond the CNA training? And so we've taken the funds to be able to begin this training, to strengthen the programs that exist, to allow our employers to not only keep their models that work for their hospital systems, but to work together in a community of practice to share and collaboratively problem solve, and then develop program interventions, which we're kind of in that phase now towards this later half of the funding period. You'll see on the screen just our dashboard, which I want to recognize has some minor errors. So I'm going to, I'll put the corrected data in the chat and you'll get an updated deck with a slide that has reflecting the data that I do want to share. And that's just through last minute reports back to me. But to
you want to share the screen, Sasha? Sorry.
I'm going to just put it in the chat because
Okay.
it'll probably be faster. So we're very pleased with the now for 5 hospital systems, but multiple training partners for some of those systems. So we have several programs in the works. And currently, as of this, the end of last month, rather, we've had individuals who begun training, 172 of them. 44 are currently actively in training. 117 individuals have completed training. However, those who've hired, we have 78 individuals who've hired. So there's one hospital system that had 2 individuals that actually did not move forward with hiring. And so the accurate numbers for hired is 78, not 80, and total currently retained would be 59, not 61. So I put that in the chat. In terms of where we are percentage to goal, you'll see that we could definitely use extended time to spend down more of the dollars to train more individuals. We have funding left over and the opportunity to do this. As of now, though, we have several programs that are going to get off the ground to help spend down those dollars and provide opportunities to CNA candidates from our target communities. So Loyola specifically is working to get their CNA apprenticeship Hire First model off the ground this coming April. And several of our other hospital systems, Lurie Children's Hospital, UI Health, all doing great work with their partners, but also identifying providers to extend and add cohorts through the summer. So there's a huge commitment of wanting to make that impact extend as much as possible by our hospital systems, and a big thank you to those here on this call who've played a major role in making that happen. Go ahead, Shonda. Yep, let's check out the chat. And if I know Shonda, she'll definitely mobilize her people to make that happen. So we're excited for that. And then a couple of updates from what we've done as a community of practice and exploring these themes that we've just talked about with the data in terms of lack of just seeing overrepresentation of Black and Brown women in the CNA role, and looking to really get at that occupational segregation piece with the efforts that we're doing in our part of the world, right? So we kicked off the year with a community of practice in person on January 7th at Illinois Medical District. It was nice to connect, but we really dug into what has been working, what we've been observing from programs, and the question that really stood out that we workshopped was what actions can we take to create more accountability and experience, more accountability and to improve the experience of participants, encouraging follow through, encouraging and ensuring that they understand expectations of their programs. So being able to develop now action steps and interventions is what is in play, and we look forward to sharing results from that in September at that quarterly meeting. We're also ongoing with lifting up in participant voice, and so continuing now to connect with program alumni, those who've graduated from the CNA programs in previous cohorts, and interviewing them to really understand at the granular level some of that qualitative data and understanding what got in the way, what worked, what could we design or adapt or figure out how to scale a little more into our program models, and really taking that directly from the program participants. So that is ongoing, and we look forward to, again, to sharing more of those results at the September quarterly. And then upcoming in April, we are doing 2 in-person events for our CNAs, again, focused on their career advancement and ensuring that they have the tools and the exposure to the options available to them within the healthcare system, rather the healthcare sector, and then specifically in their own hospital systems that they're working at. So career exploration to happen with our healthcare career advisors who were CNAs previously and now have advanced into a variety of roles within healthcare, and they're going to engage our CNAs from Good Jobs. And then we are also wanting to ensure that employment and being able to bridge from training graduation to getting hired is happening for all participants. And so we are conducting a CNA recruitment and hiring event at TTI, one of our training providers in the Good Jobs Hub, and that will happen towards the beginning of April. So looking forward to share more in the September quarterly All Good Jobs Challenge.
Thanks,
everyone.
Sasha. If anyone has questions about Good Jobs Challenge, feel free to put them in the chat and Sasha will respond. But we are going to move quickly along, a little bit behind schedule, so we're going to run through this update relatively quickly. Some of you might remember that we announced this grant, this partnership at the June quarterly meeting last year. The Chicagoland Workforce Funder Alliance is the lead grantee on this initiative. They are this is from the National Fund for Workforce Solutions, and Kylan is here to answer any questions from the Funder Alliance. the grant is focused on Malcolm X as the main driver of the learning and the implementation around the program of the grant, but CHWC is also a partner to bring in the employer lens. So the grant opportunity, the problem that the National Fund is seeking to address with this opportunity is that people of color are underrepresented in many career pathways that lead to middle and high wage jobs. That is not a result of inherent preferences, but of various structural drivers, and community colleges and workplaces often hold these drivers of inequity. So they put out an RFP to groups that included a community college and an industry partner, and that focused on a particular sector and a particular group within that sector to implement a 28-month-long project. And I know the timeline at the bottom is probably small for you. This just gives you a sense of where we're at, but there's a lot of learning and preparing at the front end. Is a learning cohort. We are just now at the very end of the design and plan phase, and we're going to move into testing and piloting, and then observing and iterating, and sharing out what we've learned over a full 28-month period. So we are one of 4 groups who have been awarded the grant. We are the Chicago team, and then we are also learning from our peers in Cleveland, Springfield, Massachusetts, and Syracuse, New York. So some of this data on the CNAs and registered nurses is what I've already shared with you today. So first thing what we did first is look at the data. Where are Black men entering the healthcare sector? Where are they not? We looked at the difference between the racial breakdown of CNAs and registered nurses. We also looked at data from Malcolm X and found that only 9% of the participants in the basic nursing assistant program are Black and Latino males. That's the data we looked at. And only 8% of the nursing participants are Black and Latino males. But while they are only a very small percentage of the student population at Malcolm X, we found that often their acceptance rates and their enrollment, their completion rates were on par, if not better than some of their peers. So this shows over here on the left side, this is from Malcolm X, that Black and Latino males have a much higher acceptance rate in the associates of the EMT associates program, for example, as well in nursing than all other peers. They have higher acceptance rates in sterile processing and in surgical tech programs. Over here, this shows the completion, share of enrollment and completion. Blue are enrolled in the program and yellow are completers. And so the Black and Latino male percentage of completers is higher in EMT as well as sterile processing and surgical tech. So we looked at the data, and then we brought in some partners to a design sprint a couple of weeks ago. We had the team from the National Fund facilitating a 2-day excellent event with lots of different activities that were all centered around human-centered design. Kylan and the Funder Alliance team was there, and I invited Jen Hayden from Ascension and Destiny Jones from Northwestern Medicine to join us and to share from the employer side. And I'd like to hand it over to Jen Hayden to share a little bit about what that 2-day design sprint was like for you and what we accomplished.
Sure. Thanks, April. Jen Hayden, workforce development with Ascension. I do have a clinical background. I'm a nurse by background. So my lens during this event was definitely, I had many different perspectives. What was unique about this in that I have been on many process improvement events, as I'm sure you all have been, which is very data driven. Whereas this, where we went through the agile focus and process, was very people focused, people centered. So we did look at data. Data drove obviously how we pivoted, how we, adjusted. But throughout this event, we had different activities incorporated throughout that really helped us test our assumptions and really test our biases. So we had many times where we thought we came to an answer, and then we would do a group activity, which a lot of times involved the creative side of our brain, which I don't work on. And I've learned many of us in the room don't. There were a lot of stick figure drawings, which was perfect. But it really helped us get out of that side of the brain that we typically think about or use, and really incorporate that human value, that human centeredness, along with the data to support where we were going. So after day one, through many, many iterations, we were able to come up with our problem statement. We actually came up with two because we had so much, and we really wanted to, accomplish what the data told us, which was there's a disproportionately low amount of Black males who are even applying into the healthcare programs. So what's happening that we're not even bringing them in, because we know once they're in, they're admitted, they're accepted, they're successful. So our statements that we developed, statement one, careers in healthcare are in demand and offer pathways to good jobs. However, Black men are underrepresented in healthcare roles, while Malcolm X College boasts high completion rates for credentialed programs that lead to healthcare occupations like EMT, paramedics, surge tech, and registered nurse. Black men enrolled in courses at Malcolm X do not enroll in healthcare programs at a proportionate rates to their peers. And then statement two, Malcolm X and his industry partners do not engage Black men in a way that helps them envision themselves being successful in healthcare career or nurture their career navigation, such as help them decide if pursuing a healthcare career is for them. So these were our problem statements that we set up to solve for in this journey. I would say it's a journey because we definitely are, you saw in the timeline, are close to maybe the front end than the back end. So after day one, through many iterations, these are our statements, these are our problems that we're looking to solve.
Thank you, Jen. And then Destiny also joined us. Destiny, can you help us with the ideas we came up with?
Yes, excuse me, my allergies are kicking my butt a little bit, so if I sound a little congested, excuse me. But it was such an honor to be a part of this group. The way that everyone was very open and attacked this in such a way that, just like what Jen said, that was very human focused and looked at the entire person. So what are the barriers that Black men are experiencing as they go about these positions? And so based off of what Jen was talking about in that day one of really trying to figure out those problem statements, we then had to figure out, like, how might we solve this? And so a very beautiful strategy that they came up with to help us kind of come up with ideas was just that. How might we get more Black men into healthcare? How might we, fill in these gaps and build these bridges for Black men wanting at Malcolm X? And so, yes, we did have to kind of use our creative side with drawings, as you can see in the picture, and stick figures. As people who work very closely with me know that I am not a creative mindset where I can draw and put these beautiful pictures together. But man, it really helped us step outside of our comfort zone. It really helped us think about things in a different way. And because of that, we were able to come up with 4 ideas to kind of help us solve or get closer to a solution for those problem statements. The first one, which we did end up doing, which we're going to talk a little bit more about, is design a work study peer champion / ambassador position that facilitates a peer network to support students entering or thinking about entering healthcare programs at Malcolm X. So this is the one we decided to move forward with, is using the peers to kind of encourage and support those Black men in their programs at Malcolm X. But then 3 other ones that we landed on, just like you saw in the that Jen was talking about, because we had so many incredible minds working on this project, it was hard to narrow down. It was hard to find out exactly what we wanted to focus on. But we did have these other 3 ideas that we are not moving forward with. But it doesn't mean that it's not possible later on. But design a web-based platform that connects a diverse group of healthcare professionals with Black men interested in entering healthcare programs at Malcolm X. And then design a long-term social network for Black men pursuing healthcare careers that focus on bringing healthcare professionals into the community, as well as bring Black men into healthcare settings. And then that final one was develop a student-led communication strategy that helps students understand what careers in healthcare offer them. And so we're very excited about what we did land on. And April and Kylan will talk a little bit more about what those next steps will look like. But man, it was just such an honor and such an amazing experience being a part of this. And so I'm so happy we're able to share this information with you. And I'm so happy with how we're moving forward. So thank you, April and Kylan.
Thank you, Destiny. Yes, it really was a great experience. And as Kylan mentioned in the chat, we not only looked at the data, but we also, Malcolm X conducted some focus groups with Black male students. And something I appreciate about the process is that we are continually going back and making sure that we're centering Black male students and asking and checking our assumptions about what we think might be impactful and asking them. And our idea of focusing on a peer ambassador position really does put, students at the focus in the leadership seat. So I'm really excited about this idea. Right now, our next steps in continuing to check our assumptions and make sure that what we're doing is actually in line with what students need and want. We're going to complete empathy interviews with students. Again, we are going to work on the logistics of what this peer ambassador position looks like, how it is organized within the work study program, how what the job description is, how we recruit for it, etc. And we are also going to be working on some of those other ideas that show up in the 4 ideas that Destiny just presented, but also in other ideas that came up over the 2-day design sprint, and think about, even if we're not focusing on that as a part of this grant, how can we bring that particular idea into CHWC or into some of our stakeholder partnerships at this table. Kylan, did you want to add anything that I forgot?
I don't think so. I think that's a good summary. So I'd be more interested to see if people have questions, or I guess the one thing I would throw out is, as you can see kind of in our next steps, it's kind of very like logistical heavy, and so it's going to be very Malcolm X focused for the next little bit, just because we had to figure out like who will supervise the student, all those kind of things. But once this actually starts rolling out, a thing we talked about a lot in what this student could be doing is helping set up like networking connections with industry, or having industry leaders connect personally with these student leaders to help give insights to them. So we're definitely going to need the support from this group. And so even though like we're not going to make any of you sit through the meetings on like the nitty gritty on how to get this going, your partnership is definitely going to be needed as we move this project forward.
Yes, thank you. Does anyone have any questions? I have really packed the agenda here. So I'm going to invite anyone to ask questions in the chat, and Kylan can respond. And I assure you that we will update all of you, especially in ways that you can participate in this project moving forward. And now we have 15 minutes left, and I have a feeling that everyone is going to be very interested in what Jordan has to share. So unfortunately, I'm going to say, if anyone has a community announcement that they'd like to share with the group, if you could put that in the chat, or you can also feel free to email me any announcements anytime, and I can include those in our newsletter. I am planning to send out a newsletter later this week. But one of the things we want to do at CHWC is leverage our collective voice. And when there is something for us to stand behind and to put our support behind as a group of very impactful employers and other stakeholders, that we do that. And I know that policy is probably top of a lot of folks' minds right now. So I'm very happy to introduce Jordan Powell, the Senior Vice President of Health Policy and Finance with the Illinois Health and Hospital Association, to share a little bit about what they're focused on right now and what else we might hope to do together down the road. So take it away, Jordan.
Yeah, thanks, April, and good morning, everyone. Again, Jordan Powell with the Hospital Association. And for those that aren't aware, our organization represents every hospital in the state of Illinois. And I would say the number one service that we offer is advocacy. We're usually state focused. So I'm based down here in Springfield. The capital is just a block away, and we work with our legislators, also Chicago City Council, and then U.S. Congress to advance policies that benefit hospitals. I mentioned that we're usually state focused, but as you can imagine, there's a lot of federal focus right now for our organization. And I would say one of our top concerns is related to Medicaid cuts. So we've got the president, President Trump, who has made it clear that he wants to continue his $4.2 trillion in tax cuts, and he's directed the Congress to find $2 trillion rather, and spending cuts. And just last week, we saw the House pass their budgetary framework, which really just sets the stage for budget negotiations, on a vote of 217 to 215. So it's really close. In that budget framework, they have instructed one of the committees that oversees the Medicaid program to find $880 billion in cuts. So it's the Energy and Commerce Committee. They have jurisdiction over Medicaid, and looking at the large number of cuts that committee has to find, we don't believe there's a way they can do this without touching Medicaid. So if you kind of just look at the slide here and what some of the key Republican leaders are talking about, they're specifically talking about changes to Medicaid. So obviously that is concerning for us here in Illinois. What's interesting is that the president some days says he's not going to touch Medicaid or Medicare or Social Securities, and then other days he remains silent. So we're taking this threat seriously, and I'll share in just a bit what we're doing to fight back. We're particularly concerned in Illinois because we have a trigger law that would have significant consequences for our state. So the Affordable Care Act, Obamacare, a great piece of legislation that expanded Medicaid to childless adults. And so expanded Medicaid in Illinois to over 750,000 people. Another great thing about that law is that it increased the federal financial contribution back to the states. So for typical Medicaid, the state of Illinois pays $1, we get 50 cents back. But for these ACA adults, so those that were expanded under Obamacare, we pay $1, we get 90 cents back. Well, Illinois law says if the federal government decreases that 90% match, even by 1%, then we're not covering that entire population. So essentially, we would be left with 750,000 individuals that have relied on Medicaid and have benefited from Medicaid would no longer have access. This would also result in a loss of $40 billion in funding to the state of Illinois over the next decade. So again, significant consequences to providers, to hospitals, and of course, most importantly, to patients. So what are we doing about it at IHA? Well, our CEO just a week or two ago wrote an op-ed in Crain's talking about what will occur if Congress cuts Medicaid funding. You'll see here more Illinois hospitals will close. We think that is a risk. We also have a delegation in Washington, D.C. right now. So our Vice President of Government Affairs is in D.C. with a delegation of hospitals. We're meeting with our congressional delegation, specifically the Republicans, to tell them, no, we don't want to see any Medicaid cuts and the real impact that it will have on congressional, particularly their legislative districts and their constituents within their districts, and of course to the state of Illinois. So more to come there. This is going to continue over the next few months, and I think it's going to be a big fight. You're going to hear a lot about it, and we're going to stay on top of it as much as we can. I'm sure we'll be back in DC several times over the next few months, but more to come there, and you may see more op-eds like this in the future. Just looking quickly at the state of Illinois proposed healthcare spending budget. So Governor Pritzker just gave his budget address a week or two ago. No decrease, spending in Medicaid, no decrease in Medicaid services overall. However, a pretty important program for undocumented immigrants ages 42 to 64 that provided Medicaid coverage was eliminated in the governor's budget. There's been, I wouldn't say controversy around this program, but a lot of focus around the significant costs that's come with this program that the state didn't originally anticipate. So people have taken advantage of this program. I don't mean that in a bad way. They've taken advantage of the right to get access to Medicaid and healthcare services, and it's just cost the state a lot of money. We have a president that doesn't want to pass an unbalanced budget. So again, what I would stress is this is just an introduced budget. So the legislature is going to have to decide what they want to do. So if they want to save this program, they're going to have to find, $300 million or so in cuts to save this program. So again, this is going to be a negotiation that continues until the end of May and even longer. Just quickly here, two other priorities of our organization. One is on 340B. I'll just really quickly go through this. 340B is a really important drug discount program for hospitals. And we're in this fight with pharmaceutical manufacturers that are restricting our use of the 340B program. And I'll say for one of our safety net hospitals, this is having a $16 million negative impact. So we're trying to pass a law right now to restrict pharmaceutical manufacturers from some of their practices right now that are preventing hospitals from participating in this program. This is being done in several other states, and I'll say pharma, as you can imagine, Pfizer, Johnson & Johnson, AbbVie, very well-funded adversaries. They're going strong in other states. So you may even be seeing ads, TV or radio ads, attacking the 340B program. So that is going to be a fight for us here in the state. And then finally, that's probably the most interesting to this group is on workforce. Workforce is a priority for our organization. And I'll say for the last several years, we've been focused on, delays in provider licensure and violence against healthcare workers and recruitment and retention and pipeline programs. And what we've kind of figured out is, all these issues, as you know, are interconnected, and we haven't had as much success on the policy level in advancing policies to address these issues because stakeholders are really only hearing from the hospital association. So our idea this year is to bring together a workforce commission of healthcare leaders, healthcare experts, and then let's make specific recommendations to the General Assembly. And then our hope is that the General Assembly will then pass those recommendations. For example, the nurse licensure compact. That's something that we've argued that we believe would attract more nurses into the state of Illinois and solve some of the nurse staffing shortage that we have in the state. We've been unsuccessful in achieving and passing that law due to some pushback from the union. So would this commission recommend that we should move forward with the nurse licensure compact, or will they recommend that there should be penalties against those that harm healthcare workers? So we're hoping to put this commission together and recommendations over the next year and then back to the General Assembly. So here's the bill numbers if you want to track. House Bill 3649 and Senate Bill 1770. If you were to look up these bills now, you wouldn't see any language on there. So right now we're circulating our language with the governor. We're trying to get him on board and other key legislative leaders that will, build the framework of this commission. And I'll also share it with April once that language is added so she can get it out to the group. So with that, that's all I wanted to share this morning. And I'm happy to answer any questions. And if you have any questions after today's meeting, please don't ever hesitate to reach out to me directly.
Thank you, Jordan. Any questions? I will certainly be keeping everyone updated on the Workforce Commission as it so specifically relates to our mission here at CHWC. But thank you for your work standing up for Medicaid on the federal level. And it's been very interesting to hear what's going on at the state level as well. Nora has a question? Oh, no. I think Nora was clapping. Anyone have a question about anything today? Or a community announcement, since we have 4 minutes left. And Jordan.
I just put my email in the chat if anyone has any questions or wants to follow up on anything.
Oh, there you go. You put it in a direct message to me, but I just.
Oh, I'm sorry. We use WebEx. I still getting used to it.
WebEx is like a foreign language to me. Anna.
Yes, this was such an important topic. Thank you so much for bringing it to light, April and co. I just wanted to share with the group that if you are interested in, I know apprenticeships is something that you guys have expressed interest in learning more about. The Public Health Workforce Collaborative has our quarterly meeting next week, and the topic is going to be apprenticeships. So if you are interested in learning more about apprenticeships sooner, I welcome you to join. I'll drop my email in the chat. Just shoot me an email and I will forward you the invite.
Okay. Well, thank you all for joining. Our next quarterly meeting in June will be in person at Malcolm X. I did not confirm the location on our website or in the calendar invite yet, but it is confirmed that that will be held at Malcolm X. So it'll be exciting to see everyone in person. I am also planning an in-person quarterly in September, although that location is TBD. I hope to see you at our learning event later this month. If you don't get our newsletter, you can sign up at the bottom of our website to always be up to date with the learning events and announcements from our partners. If you have an announcement you would like me to share, please feel free to send that to me anytime. And this recording and slides will be up on the website tomorrow, if not by Thursday at the latest. So thank you all so much. Have a great rest of your day, a great week. Thank you in particular to Jordan and Destiny and Jen and Sasha for presenting. Have a good day, everyone.